Oh, you are.
If you've struggled with pain, lack of flexibility, or an injury that just won't heal, consider dry needling. So to get a better idea of how that works, Cam and Jill are joining me from Apex Physical Therapy. Welcome. So this is something I, to be honest, had never heard of. I think it's fantastic. If you want to kind of just give us an idea of what it is, and then we're going to jump into it.
Yeah, we'll jump into it, and I'll kind of explain it right away. So Jill, you want to jump up? So dry needling is a technique that's been around for a while. It's becoming a lot more utilized and a lot more popular. Specifically at Apex Physical Therapy, we have found such success with it that we've trained almost all of our PTs to do this technique. Wow. And it's a technique where we're using a needle, a really, really small needle. So it's a fairly pain-free experience. It's not overly painful. To go into a muscle, the motor unit of the muscle, or a tight band within the muscle. And what we get from that is a lot of different things. So I'm going to demonstrate here. We're going to just find a tight band. Now, Jill and I work with each other. I'm pretty familiar with her.
You know what her
There would be an
stressors
evaluation that you would do before this to determine, if this is an appropriate treatment. And we would find the tissue that we feel is right there, Jill, right? Is that a little tender?
So you're feeling pain there now.
Maybe a little discomfort,
Sure.
right? Doesn't necessarily have to be pain, but we would have determined this to be an appropriate site for her. And then we put this really small needle into the skin, and we are going to go down to find that top band. Now, the size of this needle is so small. Most people's experience with needles are with injections, right?
Or flu shots.
Flu shots, right. Yeah. Those are hollowed needles, right? Because you got to push that fluid through it. This is not a hollow needle. So about 15 to 30 of these needles could fit inside the needles that we get when we get shots.
Well, that's comforting. So
it's really small.
Right.
Right.
You barely feel it.
And then we go down. Jill, you got a nice little twitch there, I felt, right?
Yep.
So I'm feeling for when I hit that tight band, right? Now from here, we could do a few different things. We could put some stim up to it. There's a lot of different things. But the purpose of this is when we get the needle into that taut band, we can do a couple of things. We can help activate that band to release the tightness, right? Which can be a great benefit to us therapists with all of our other therapies. We can also get some pain relief from it, right?
Interesting.
Another benefit is it can kind of activate this neuromuscular system. Our body is really crazy in how everything's connected. So if I treat here, I could maybe affect some of the neurological or radicular symptoms that maybe she's coming in with hip pain, but we've determined that this is part of the problem. So it gives us a window of opportunity to release, get some pain relief, and I'm going to take this out, Jill, okay? And then have an opportunity for our other therapies to be more effective for her, right? So we're not fighting through as much pain or discomfort, and really giving us a good starting point for having better success with patients.
Well, that's the thing is it does seem like everything's connected, and sometimes, we try to treat it from the outside. Right. There's a lot of different specialties you can go to where they're cracking things or moving things or whatever, but sometimes you got to get on the inside.
Yeah. And I found that that's probably one of the most beneficial things. And I still do a lot of superficial techniques, right?
Yeah.
I'll do deep tissue massage, and we'll do joint manipulations. This is another tool that with the right person that has that taut band that I don't want to beat them up so bad from the outside, that it allows me to get in there, get a quick, effective treatment, and make change fast.
So speaking of the right person, what kind of conditions do you typically treat? What kind of people do you work with?
Right, so everybody really. Dry needling works really well for people who have low back pain, so like you just saw Cam needle my back. He also talked about some nerve issues, so sciatica is one we'll see. There'll be nerve pain down the back of the leg, which we can treat at the back or the hip, really depending on where the problem is. We treat a lot of hip issues, so hip pain, hip arthritis needling can be helpful for. SI joint pain, things like that. Hamstring issues, knee arthritis, knee pain, shin splints, plantar fasciitis.
It really, when people ask that question, you feel like you're kind of a salesman with it, because it's like, oh, I can help everything.
Yes.
But truly, it's a piece of it. It doesn't fix any of those things. but it helps us have success with all of those different conditions.
And that's probably why it is very important to have someone, like especially Apex Physical Therapy, where you can work with them and they can see the holistic approach of like, okay, we know that you have this pain, we're going to tackle it by doing these 3 different things. Now you guys opened a second location. Where's that at?
So we're in South Fargo off of I-29 and 52nd Avenue South. We have physical therapy, so orthopedic women's health. I'm one of our pelvic health therapists, so I actually dry needle the pelvic floor also, by the way.
Hey, if you need it.
Yes,
you know?
but we have massage therapy, craniosacral, and we also have the e-gym. So that's really awesome new gym equipment, strength training equipment that we have down there that we can offer to our patients and the public soon.
Yeah.
Well, that's fantastic. So if you have some things that maybe you want to get sorted out and you really want the holistic approach to a lot of different things that could include dry needling, get in touch with Apex Physical Therapy. Their information is right there on your screen. And stay with us. Coming up next, we're getting revved up for the toughest monster truck tour. Stay with us.